There are now 26 studies in the medical literature that I could find in languages that I can understand, and I reviewed all of those studies. Of those studies, of the 26 studies, 25 show no increased risk of recurrence of breast cancer among women who take hormone replacement therapy of any kind, and that is independent of whether they had estrogen receptor positive or estrogen receptor negative breast cancers. The one study that suggested an increased risk of recurrence, that reported an increased risk of recurrence, is a study that was done in Sweden called the HABITS study, Hormones After Breast Cancer, Is It Safe? That's an acronym. And that study reported an increased risk of contralateral or local breast cancer, not an increased risk of distant recurrence. There was no increased risk of death from breast cancer in that one study as well. That one study has several problems, the biggest problem being that study did not mandate baseline mammograms for women going into the study. If the only risk is a local recurrence or a cancer in the other breast, a baseline study mandating that it wasn't there before starting, you would think is important, and that wasn't done.
Yeah, big problem. So the studies that you're referencing, you wrote an article. Can you just speak to that in the Cancer Journal? And you really summarize it quite well in your book for people who really want to get into it. But I think it's really important for women to hear that sentence you said, that there are such a large number of studies and then reviews of those studies, correct?
Yes, there are 20 reviews. I said 26 articles, 20 review articles, none of them, with the exception of the HABIT study, which is a faulted study, show an increased risk of recurrence. 4 show a decreased risk of recurrence. But people hear the word breast cancer, it's a red flag. Both patients and physicians are frightened by that red flag. When you look at confirming evidence, you see that women who get pregnant after a diagnosis of breast cancer, which floods their bodies with estrogen, women who have in vitro fertilization, which further increases the risk of the level of estrogen in the body, have no increased risk of recurrence following a diagnosis of breast cancer.